Hello, my name is Bernard Camins. I'm the Medical Director for Infection Prevention for the Mount Sinai Health System. Monkeypox is a virus that is in the same family as smallpox and cowpox. As you probably already know, smallpox has been eradicated years ago, and so we do have to worry about monkeypox every now and then. For the most part, most of us should not really worry about getting exposed or even getting monkeypox. There are some people who have been exposed while traveling abroad in Europe, or even people who travel to Africa could have had be exposed to either someone with monkeypox or even directly from an animal with monkeypox. The current situation is that some people who have traveled to countries in Europe have been exposed to people with monkeypox, and so potentially they could be at risk for also having monkeypox. But it's very rare. You would only worry about monkeypox if you knew of someone who are suspected of having symptoms or who have been diagnosed with monkeypox. The hallmark of monkeypox is actually a rash, but before the rash appears, people can actually have fevers, just being tired, malaise, so non-specific symptoms. Another hallmark is actually diffuse lymphadenopathy or enlarged lymph nodes. So if you do have fever and enlarged lymph nodes, and you were exposed to someone suspected of having monkeypox or someone who has been diagnosed with monkeypox, then you need to seek medical care. If a doctor suspects a patient has monkeypox, even before the rash appears, we instruct them to actually isolate the person in a private room. They will then wear uh, personal protective equipment that includes an N95 respirator, gowns, and gloves, and then they will actually do an extensive interview. One of the things that needs to happen is that we actually need to know the details of interactions with um, people who may have monkeypox. One of the key things that decides if someone needs to be tested, as this is a very complicated issue, is that if someone actually has an epidemiological link to someone with monkeypox. So either they traveled abroad and were exposed to someone, or that they are actually at high risk for having monkeypox. So why are we talking about monkeypox? While monkeypox is a viral infection that's really rare, uh, a large outbreak has occurred in the U.S. before in the early 2000s, and that because it is a rare disease, people don't think about it. And so it's good to just inform people, even though the likelihood of the average person living in New York being exposed to someone with monkeypox is really low. But we do have a lot of people traveling from around the world. And monkeypox is endemic in Africa, and currently it is spreading in countries, even though very few cases, it is spreading in countries that are not normally endemic, meaning monkeypox is not usually found in those countries.